Number one, ask. It's exactly what Dallas had said before. If you don't count if you're not counted. So ask people about their sexual orientation, their gender identity. I will tell you, the first time anybody ever asked me, and I've been out since I was 19, anyone asked about my sexual orientation in a doctor's office, I was in my 40s and it was someone I was friends with. And it's interesting when you do large trainings of LGBTQ 101 and you start getting into this and you just ask people in general, other than the OB's office, has anyone ever asked you about sex? Has anyone ever asked you about your gender identity? It is so incredibly rare. There's one of the speakers I heard, I wish I could attribute it because I know it's such a great quote about how it's easier for us to talk about sexually transmitted diseases than to talk about sex. It's easier for us to talk about, pathologies of gender than to actually talk about gender and to ask about identities. I think we still have that streak of the Puritans within us that like we don't talk about that in the office. And I think more and more we're realizing that you do need to talk about that. People matter in a much more holistic sense. And there's a lot of times you can't practice good medicine if you don't know about their identity. I mean, with trans people, 100%, because a lot of trans people will want a medical transition of some sort or need a medical transition of some sort. You have to know about that. And the number of, so pediatrics, the number of kids I've seen who no one has ever asked them, mental health, physical health, no one's ever asked them. And then you ask their gender identity and they look at you like this combination of absolute fear and absolute happiness that someone is going to see them is just remarkable. And suddenly you're finding out about all those things that they've just been going, they've been a teenager going, when you're asking them. And now you get to know about it. So I think that is the number one thing, is make it part of your routine of who someone is.
Yeah, I love the idea of baking it into assessment. I also, might I might encourage just any clinician to think about the pathway of mutuality, right? That it's not just helping, but actually the trans and gender diverse LGBTQ community has a lot to teach healthcare in general. I think where this starts actually is for every single clinician to sit and think about their own sexual orientation and gender identity. Who have I ever been attracted to, right? What do I think about my gender, right? And really think about it, because you might find that you yourself are a little more queer than you might have thought at one point in your life, right? We all exist on these different spectrums. And then what I might also do is, in my experience as the CEO at Trans Health, when hiring folks, it was much easier to find gender diverse nurse practitioners and PAs than MDs. And that, I think, is not because trans people don't want to be MDs, but because there are some systemic barriers that exist in trying to get higher education at times, right? And sometimes it can just be easier to, financially enter in as a nurse than go through all the loans and, time of medical school too, right? Different pathways, different philosophies. But the thing is when we talk about all the discrimination that's occurring to these communities, right? They're just not educational settings where trans folks, where a lot of LGBTQ folks can actively be themselves and authentically be themselves and navigate past those barriers, right? So what I would say for anyone watching this is try to try to create mentor-mentee relationships with maybe some of those folks, right? Think about how you might be able to support them in different ways. Maybe they can come in and learn a little bit about this through like an intern or mentor program, or become a PCA and start at some entry-level space. There's just a lot of ways in which, kind of going back to hiring in the systemic spaces too, that we can, I think, be inclusive of a lot of folks and bring them to the table. And then finally, I would also say that I think what we're doing here at Trans Health Northampton is pretty, it shouldn't be revolutionary, but it is. Like, we are having enough time to actually talk to patients about their identity, who they are, what their goals are, where they want to go. We're having enough time to be able to ensure that our staff are not burnt out in any way. And we're really trying to center affirming, holistic, comprehensive care at the center here, where maybe some of this is about medical needs, but maybe some of this is about community support. Maybe some of this is about stuff that would never be talked about in a provider's office in general. And so I think there's a lot of beauty here that the trans community has created over years and years and years, that the queer community has created, the LGBTQ community has created. We've all done this together. And there's a lot that the LGBTQ community can then come back and teach healthcare in general.